Hi, my name is Adriana Rosales, and this week for PTA 320, week 9, the video response, the patient is named Jamal. He is 2 weeks post-operative surgery of an Achilles tendon rupture. He is still in an ankle-foot orthosis. So what we're going to do in terms of rehabilitation at this point, we're going to have him do some really gentle range of motion exercises in plantar flexion and dorsiflexion, because that cam boot will restrict any motion beyond that neutral. It should be safe. We're going to have him in a seated position doing some heel raises that are non-resisted just yet. We're going to work on just doing heel raises with the orthotic on his foot, as well as some passive range of motion just to get things moving in there. And then as the cam boot changes, then we can work through a larger range when he's able to move a little bit more into dorsiflexion and plantar flexion. The precautions we're going to be using in this phase of healing is not to overstress the tissue. No aggressive plantar flexion. He is in a partial weight bearing state, so making sure that we're progressing from a toe touch down to partial weight bearing status. He can still use his crutches depending on pain tolerance. Right now we could work on bilaterally, but then later on, as he gets stronger, then you would progress him to unilaterally, or even in like a inline stance, something like that, to get his foot a little bit stronger, depending on where he's at in the phase of healing. Other interventions that we could utilize in this phase are going to be soft tissue immobilization. We could pay attention to if there's any edema, any swelling, so then we could utilize interventions for that, like ultrasound, no heat, obviously, and then some cryotherapy if there was any edema. If we were past that stage, there's no edema, then we would want to use heat so we can improve the tissue elasticity, maybe improve the range of motion. Also, we could do isometrics with his foot in the cam boot as well, just safely doing some toe curls, so we could utilize his toes, not really so much in plantar flexion and dorsiflexion, like having his foot on the ground with a towel and just curling his toes to pick up the towel and then to drop the towel. So we can utilize those exercises as well. And lastly, we can always improve the muscles that are unaffected, such as the hamstrings, the hamstrings, the quads. We could do a knee flexion. We could do straight leg raises. We could do different exercises that are going to improve overall lower extremity strength, as well as cardiovascular endurance exercises, like biking, non-resisted biking, swimming in the pool, things of that nature. First exercise is going to be heel raises in a seated position, and very gently and slowly, we're going to lift up those heels and then slowly release them back down to the ground. Again, if you can see my feet, I'm doing a very little range of motion. And again, we're going to patient tolerance here. Second exercise, we're going to scrunch the towel with our toes and release the towel. Scrunch the towel with our toes, release the towel. All of these exercises will be 3 sets of 8 to 15 reps, depending on pain tolerance of the patient. Last exercise, we want to have our patient put their foot on an elevated surface, making sure that their knee is supported under a pillow here, or a foam roll or a bolster. And we're just going to do some very gentle range of motion exercises. We're going to do our ABCs. So A, B, C, D, and so forth until the alphabet is completed.